In the Highlands of Kenya, where valleys cut deep and hills stretch to the sky, lies Elgeyo Marakwet, a land of beauty, endurance, and promise. Known for producing world champions in athletics, yet behind the strength are silent struggles in health that too often go unseen. Here, families walk long distances for care. Non-communicable diseases like hypertension and diabetes grow silently. Maternal and child health challenges persist. And while endurance is a way of life, access to healthcare should never be a marathon. But on the 30th of August, 2025, hope came alive in Iten. The M-Pesa Foundation, powered by Zuri Health and in partnership with the county government of Elgeyo Marakwet, hosted a free medical camp, a day where healthcare met the people, no matter how far they came.
Today we are here at Kapkoros Primary School in Elgeyo Marakwet Sub-County, where we've had a successful medical camp. We've been able to see over 3,000 people, and we've been able to offer a number of services to them. So from the registration section, our patients proceed to triaging area where their vitals are taken, and where we are able also to identify patients with chronic diseases like hypertension and diabetes. From the registration section, our patients are also able to visit the consultation area and laboratory section for different tests, and also for ultrasound services after the doctor feels like patients need to be seen, for radiology services, ECG for cardiology patients, and also other specialist services. This camp has had an impact to the community, more so for patients who are having trouble accessing healthcare in the rural areas. So, for example, we've been able to offer specialist services remotely, and also for patients who have also been able to come here, they've been able to access part of the medical services that they could not get while at home. I'd like to send out a special thanks to M-Pesa Foundation for making this camp a success and providing us with the necessities to make this camp, and also to Zuri Health and the medical practitioners at large for their dedication towards the local area and also for serving the community.
For the county government of Elgeyo Marakwet, this partnership is a promise kept, a commitment to ensure that no resident is left behind in the journey to health.
Asante sana, nachukua fursa hii kushukuru sana timu yetu kutoka Safaricom, specifically M-Pesa Foundation kwa hii medical camp ambayo wametupatia medical camp kubwa. Naelezewa ni watu maelfu wamesaidiwa tangu asubuhi, na bado unaona the whole field imejaa, watu wanaendelea kuhudumiwa, ambapo watu wanapimwa, wanapewa dawa, wanapatiwa follow up. Hatujawahi pata medical camp kama hii. Tumefanya mengi, lakini Safaricom Foundation ama M-Pesa Foundation ama Safaricom mwenyewe wanatufunza mambo mapya. Tunashukuru sana kwa njia ya kipekee. Esther, who is the head of M-Pesa, and your team, and our sister Karen from Safaricom Foundation, please communicate and take back our gratitude to the CEO. And on behalf of the great people of Elgeyo Marakwet, please receive our gratitude. We want to appreciate. We want to welcome you again to Elgeyo Marakwet. We want also to welcome you to continue partnering with us as the governor of this county. For as long as I'm the governor, just know that you have a partner in Elgeyo Marakwet County on all aspects, from commercial all the way to humanitarian items that can be able to transform our people.
I know you're seeing us here at the medical camp. The medical camp is one of the things that we make sure we do in every single county to make sure that we are giving preventative healthcare to our customers and to the constituents of every single county. Why is this important? It is important because if we're able to then take care of ourselves proactively, it means that the burden of healthcare over time starts to reduce. It means that all the facilities that are available to us through SHA become relevant for us to be able to use, and you can save. That's why we have participated in terms of making sure that healthcare is the primary thing that we give. Underpinning that, we also take care of education. So in the county, as His Excellency Governor Rotich has indicated, we have spent over 145 million shillings building schools and making sure that the constituents of Elgeyo Marakwet are able to receive good quality education. Women are the cornerstone of our society. And so we had the privilege of breaking ground for a maternity center where children could be delivered safely. Theatre is now available. Good antenatal, postnatal care has also been delivered in a place that ordinarily would be very, very difficult to reach. We do all of this to make sure that the communities are empowered. We do all of this to make sure that the generations to come are well taken care of. It is our honor and our privilege because at Safaricom, we believe transforming lives is what we do. So the services that we use, we must make sure we're giving back to you individually as our customers so that you can continue to enjoy a healthy and successful life. We thank the Governor of Elgeyo Marakwet for his partnership, his collaboration. This would not be possible if he didn't allow us to come and work with you. So for that, we say a very big thank you to the Governor and to the people of Elgeyo Marakwet for giving us the opportunity to serve and to work with you.
For the patients, this camp is a lifeline. Many share stories of working for hours without access to care, of illnesses endured in silence. But here, hope takes form in medicine, in advice, and in a listening ear.
Kwa majina naitwa Caroline Amadila. Nimetoka actually natoka Elgeyo Marakwet, but specifically natoka Kapchela. Challenges ziko mingi. For example ni kama wakati una breastfeed, especially kama ni first time a child. For example, challenges zinakuanga hapo mwanzo kama pengine, I don't know, the mammary glands or which part of the teat maziwa inakataa kutoka. We get information from our colleagues, village, pia tukapata kutoka kwa governor. Alikuwa amekuja sherehe huko nyumbani, akatuambia mobilize na mkuje huko juu Kapkoros, at least tutapata medication. Mimi kitu ilinifanya nikuje ni at least kijana apate matibabu na kuwa na good health. Actually what I learned from nutrition concerning the child and the mother is that suppose mom akule a lot of vitamin, proteins. Vitamins should be kiasi, isiko mingi too much, because kidogo inakuwa absorbed. Proteins pia inasaidia for growth for both mtoto na mama pia. Alafu kuna carbohydrates, so which carbohydrates provide or yield energy. Kwa kumalizia, ningependa kutoa shukrani kwa Zuri Health kwa sababu at least tumepata knowledge nyingine mpya na pia tumepata zawadi. Zawadi ziko kadhaa, leso ya kubeba mtoto, uji, ya mama, chocolate. Alafu pia at least umepata information kuwa chocolate inasaidia kuongeza maziwa.
So Petals by Zuri Health, we have an initiative where we have a lactation booth where we're able to teach mothers about lactation. So we have mothers who have children, babies from infant to almost 2 years, where they're able to have a sit down and we're able to tell them about the breastfeeding positions. Apart from that, we also get to teach them about the foods they're supposed to be consuming so that they are able to ensure they have proper milk letdown and ensure their milk doesn't reduce during that whole process. Apart from that, we also get to explain to them also a bit about weaning after the kids have passed the usual 6 months, where they're able to introduce food to the children. Then from that, they're able to ask questions and we give them feedback on anything that they need to know or learn about breastfeeding or lactation in general. Then we also give them a few things to be able to supplement and support their whole process of lactation. So I'd like to say thank you to M-Pesa Foundation for this and also Zuri Health for being partners to be able to cater to the community, not just the mothers, and also creating this initiative for lactation for the mothers in the community where they're able to get to learn of things they're supposed to do, foods they're supposed to eat so that we can be able to nourish the whole community as a whole.